Everyone, thanks for joining us here for another episode. I am super excited to have someone from both sides of a recent partnership between DrFirst and Athena Health, and I'll let them give their intros. It's a little different when I have two people on at the same time, so I'll let them individually introduce themselves, and then we'll talk more about this partnership. So why don't we start with you, Cameron, and then we'll go over to John.
Hi, Jared. Thank you. My name is Cameron Deemer. I've been president of DrFirst since about 2004, nearly 18 years in now. Prior to that time, I was working largely in the PBM industry and got involved in e-prescribing and med management very early, from the early 90s. So when I came to DrFirst, it was exciting to see that it was actually becoming a standard of care in the provider community.
Great. And I'm John Maack. I'm the Chief Strategy and Corp Dev Officer here at Athena Health, and I run all of our partnerships and strategic alliances.
Well, super excited to have you both here today. It's interesting. We've had a lot of episodes. We've not just for Slice of Healthcare, but within the Slice of Healthcare network. And I don't think we've ever had DrFirst or Athena Health on, this is very rare. So I'm glad this finally happened. It's a long time in the making. So super excited to chat with both of you here today. What I would love to do, we keep these short and sweet, but it's great for everyone to kind of hear from each side. I would love, why don't we start with you, Cameron? Give us your take on, what this means, why you're excited, why you decided to do this. Sure. And then, John, we'll kick it over to you after Cameron.
Yeah, let me start kind of broadly. Athena Health was a really great partner for us. The thing we've always admired about the company is the way they share our focus on freeing up the doctor to be a clinician versus, being a technology expert or being a billing coordinator. Their company is always focused on, look, just get back to being a doctor. And that's us too. We're called DrFirst for a reason. So our ultimate aims are very similar, and it's great that we've been able to partner up together to address prescription abandonment, which still remains a problem in the industry even today. So I can go into that in a little bit more in a minute, but I wanted to mention that objectively, if you think about prescription abandonment, everybody really wins when patients comply with therapy. But scale is important, even though it's a win-win-win all around, scale still matters. And the major stakeholders in the healthcare space who are concerned about, therapy compliance really struggle with trying to work with hundreds of players, each with their own footprint of physicians and patients. And it's much easier for them to concentrate on partnerships with big footprints. Unfortunately, even the biggest companies in our space don't really have the scale to be easily accessible by these big stakeholders. So the partnership with Athena Health is a way that we've managed jointly to overcome that issue. Athena is a very key player in healthcare IT, big footprint. We bring 300 EHRs to the mix. And by combining our docs, Athena docs, we provide a compelling reason for these healthcare stakeholders to agree to provide the services we need to support patients as they make this journey towards successful drug therapy. So we're very excited about it.
And I think on the Athena end, look, we are first and foremost an open ecosystem. We have more than 175,000 providers on the Athena network overall. We touch about 20% of patients in the United States. The Athena doctors provide care for that share of the population. And we're also kind of truly one instance of code, which means that we can very effectively share out stuff. So when we work with Cam and the team at DrFirst, this is going to go out to all of those Athena providers immediately. So that ability to have that scale impact is really exciting and important for us. And I think core to our mission and vision is the idea that we aren't going to be able to do it all ourselves within the EHR. And so thinking about services like DrFirst and a lot of other of our partners, we're constantly looking at how can the industry team up to solve problems for patients and for physicians. And we've been super engaged with DrFirst for a number of years. And this is just a deepening of that relationship.
Let's talk through a little bit around, we were talking about it when we were just chatting before the recording. Why is patient abandonment still a problem today?
Yeah, so let me start with like the scope of the problem. Today, I mean, even today, whenever a doctor writes a prescription and you leave the office, 20 to 30% of patients, depending on the drug class, are still never picking up that drug at the pharmacy. And it's odd because, I mentioned getting started with e-prescribing in the early 90s. Way back then, there was a big argument in the standard. NCPDP created the first standards around this. There was a big argument at the time where people were trying to decide, look, when a doctor writes a prescription, should it go to the cloud and just hang around in the cloud until a patient goes to a pharmacy? And then the pharmacist, goes out and grabs it down from the cloud. That was one school of thought. The other school of thought, which included nearly everybody, pharmacies, payers, PBMs, and even members of the provider community, was no, 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 no. That's kind of what happens today. You rely on the patient as a delivery vehicle for the prescription, and that doesn't work. They never go. They don't make the delivery. So what we need to do instead is send the prescription directly to a pharmacy, and then the patient will have this psychological burden that they need to get down there and pick up that script. So e-prescribing was supposed to solve that. And even though it's nearly universally rolled out now, it really hasn't made that much of a dent in the problem. What it did create an expectation the patient would show up. So the pharmacy will immediately fill the script when they receive it, and they put it in the will call bin and wait for you to come by. But there's only been a marginal improvement in abandonment, and there's this whole new burden on the pharmacy. Now they do the work of filling the script, and then 15 days later they do the work of unfilling the script, and it's very frustrating. It's one more hit on profitability, and one more. I mean, it hasn't solved the problem. Patients still aren't getting well. So that's the problem that we're trying to work on. And what we're doing together with Athena, I'll just chat a little bit about like what we're trying to address specifically. We view three major barriers to getting and staying on therapy. The first is that prescriptions, like the number one cause, prescriptions get abandoned because of sticker shock. The patient leaves the doctor's office. They're typically not immediately thinking of the cost of the drug. They have no idea what it's going to run. And then they have this, wake up moment when they're at the pharmacy counter and they see how much it's going to be, and they're just not interested. Or maybe after leaving the doctor, they just assume that it will be very expensive. They can't afford it, so they just never go to the pharmacy. And certainly if they do find out the price and it's more than they feel they can afford, they don't have the tools to address that expense. So sticker shock's number one. Second thing is not really understanding the purpose and the importance of the drug therapy. I mean, again, think about if you've ever been to the doctor and you got bad news. I mean, basically anything the doctor tells you is bad news, except, you're really in good shape. So if you get bad news and you're going to have a prescription, you leave the office, you don't remember how many prescriptions you got, you don't remember the name of the drugs, you don't remember how you're supposed to take the drugs, you don't remember anything because all you're hearing is the bad news. So not really knowing why it's important to pick it up is another blocker. And frankly, procrastination still exists, right? And if the patient doesn't pick up the drug quickly, the urgency to pick it up tapers off pretty dramatically. So, between DrFirst and Athena Health, we are now reaching out to about 3 million patients a week. And, giving them like a set of tools that really help around this issue of abandonment. So we go after it in several ways. We we engage the patient when they're receptive, which generally means, within 10 minutes of leaving the office, when they're in that decision point about, do I pick up my drug or don't I pick up my drug? That's when we want to touch them. And we reach out and remind them that they do have prescriptions. Here are the drugs. Here's the pharmacy it's going to. We give them full price transparency. Here's exactly how much that drug is going to cost you when you get to the pharmacy. So they have a chance to come to grips with that before they show up. And then we give them tools to help them deal with that cost, whether it's a consumer card that could help reduce the cost of the drug, or it may be like a pharma often has special funding programs where they can help reduce copays for a patient with insurance. We make sure the patient is armed with all of that information. And then we address the education issue, forgetting what the drug's for by providing like generally a short, very clear video that describes, why are you getting this drug? What's it supposed to do? How do you take it to get the best results? And then finally, and very importantly, we give them a call to action. We get them to commit to actually go to the pharmacy and pick it up, which helps many of them get over that last step. And the results are quite strong. We've seen results up to 14, 15 percentage points improvement in those abandonment rates. And whenever you see any kind of improvement, that's really a win for everybody involved in the process. So that's what we're doing together, and it's very exciting to see the scale at which we're able to accomplish it by working as a team on this.
Super exciting. I'm excited for both of you and this partnership coming together, and it'll be interesting to see how it continues to evolve. Great starting point for where you're both at with this relationship. John, is there anything you wanted to add to the relationship as well?
Yeah, I think Cam said it super well overall. I want to hone in on two kind of key points that he mentioned that I think are critical to us. I think number one is making sure that care guidance sticks. And that's a broader thing that we're focused on at Athena around closed loop prescriptions as well as closed loop referrals for things like imaging, et cetera, right? And so this kind of partnership is part of a general set of value props that we're trying to bring to our providers. I think the second thing that I really liked about the way that Cam described the partnership, which again, we've been talking about for some time, is how do I make sure that there's a force multiplier on that time in the doctor's office, right? Our job at Athena is to enable that provider in the middle of that care delivery episode to help remember what they need to know about the patient, what should they be mentioning, what should they be talking, and then help them document that encounter. But the reality is that we spend, most of us, 98.5% of our time outside of doctor offices, and if you're lucky, even more than that outside of the doctor's office. But we get better in the community. We don't get better in the doctor's office. The doctor's office is a catalytic event. And what Cam and DrFirst have really at their core that I love is addressing affordability for those patients and addressing understanding in a way that can't necessarily be fully captured within that doctor's office visit. And it's something that we at Athena are looking at even more broadly. We're looking at our own efforts around chronic care management, which is having nurses work as extenders of the practice to call patients and help them get follow-up on things like drugs as well, right? And so that concept of it's going to take several touches to help people nudge towards the right decisions for them and their health outcomes, I think is just really a true challenge of the industry. And I love finding partners like DrFirst who can help us help our providers get that 360-degree level of relationship, touch, and outreach with their patients to help get them all the way better.
Yeah, that's actually something that we really admire about Athena. Though, when you think about medication management, there's really four parts to it. There's like the initial assessment and reconciliation of what's wrong with the patient, what care are they receiving now. There's a prescribing process. There's a dispensing of the drug. But what John's talking about is the fourth area, which is monitoring. What happens next? That's typically a black hole for the doctor. They send you on your way with their best advice, and it's totally up to you what happens next. So, today we're working together to provide the tools to make sure that's also a good outcome for the patient. But coming soon, we'll also be giving feedback back to the doctors to let them know, how does the patient feel about the therapy? Are they experiencing side effects? Have they discontinued? Have they modified the therapy? I mean, don't tell her I said this, but my mom's real big on, like, yeah, they told me to take that, but my stomach was upset, so I only take half a pill once a day instead of 2 pills twice a day, that kind of thing. So reaching out, gathering that information, putting it back in the doctor's hands, really lets them make progress toward, feeling like their work actually pulls through instead of it just stops at the office door when the patient walks out.
Well, Cameron, John, once again, really want to thank you for coming on the podcast today to share your thoughts on this recent partnership. We'll have to have you come back on again soon to kind of, give us an update on where things are at, and if the relationship has even taken another step. Who knows? You never know in this space. And really, really appreciate having you both on here today, and wish you both the best of luck.
Thank you very much, Jared.
Thanks, Jared.